Hey guys, it's Nurse Amy here.
And Nurse Carm.
And welcome to the Medical Mission,
where you'll find everything and anything medical related.
Today we have a good topic for you, a popular one. What to pack in my hospital bag. Number one, the most important thing, bring a normal size hospital bag, guys. A duffel bag will do, a carry-on luggage bag. You don't want a whole bunch of junk in your room, people trampling over, your big suitcase that's not needed. So a normal size bag. Number two, bring overnight pads, guys, with wings, something nice and thick, nice and long. Even, you could put 3-4 of them together. Bring 1 pack, 2 packs. You're gonna be bleeding, so overnight pads.
Super important. Do not show up to the hospital with these.
No tampons, guys. That's ridiculous.
Okay.
Nothing is going in your vajayjay for at least 6 weeks.
Yep.
Okay, next, comfortable clothing. So bring about one, 2 outfits, very comfortable leggings.
Yeah.
Shirts that it's easy to breastfeed in. If you don't want to bring your own clothes, you can always wear the hospital gowns, but it depends. Do I want to look good for my visitors? Am I even going to have visitors? So don't forget your clothes. Pajamas, same thing. You could bring your pajamas or you could wear the hospital gowns. Next, bras. If you're planning on breastfeeding, I would say regardless, if you're not really planning on the fence, I would still bring nursing bras. Just in case you do breastfeed. It's so much easier to breastfeed with nursing bras. They literally, we don't have any, but it just clips down, put on baby, and there you go. They're just so much easier.
And a lot of more access to skin with the baby that way, without totally exposing yourself.
So next is underwear. You need a good size underwear. Not no thongs, not no G-strings.
Do not show up with these.
No.
Okay?
No. That big pad that I showed you is not going to hang on. It's not going to have any material to hang on to.
You see that so often.
Your underwear should look like this. Okay?
It's the sexiest it's going to get.
If you got a rump like me, they'll be a little bigger, but they should be a full coverage underwear. Okay, next we have bring your toiletries. Your toothbrush, floss, toothpaste, things for your hair, your weave, your wig, your makeup. If you want to look good, just because you had a baby does not mean you can't look good. If you're used to wearing makeup every day, of course, bring your makeup, your fake lashes, etc.
Yeah, exactly.
Yeah.
Just because you have a baby doesn't mean you can't stop yourself from being yourself. Yeah.
And slippers, guys. Bring slippers. You do not want your feet to be lingering on a dirty hospital floor.
Yeah. Next up is about dads. Super important. In our institution, we have no stretchers, nothing comfortable for the dads to sleep on. It's a small little, we would call it a couch. So we need you to bring blankets, pillows, all these extra things for yourself, comfortable clothing, because you're going to be helping mom out a lot. So you need to be able to be comfortable. Make sure you bring your toiletries. Again, like Amy said, we have nothing at the hospitals. We don't supply toothbrushes, toothpaste, none of that stuff. It is institutional based, but really, we don't really have good things. So bring what your normal is to the hospital.
And if you guys do choose to bring pillows and blankets, make sure it's something that you could throw out at the hospital. You don't want all those germs lingering in your house. Just you could buy something cheap or something that you have at home that is really worn down.
Yeah.
So next up is for baby. What do I bring for my baby? Number one, diapers. wipes. You don't necessarily need wipes if you plan to just use, you could always use face cloths and water, and it's way less alcohol anyways on their sensitive skin. About 1 to 2 sleepers. What else do we need for baby? 1 to 2 receiving blankets. So those are the first baby blankets. It's the small little baby ones. It's not a big comforter for baby. It's these little things. You might want to bring a going home outfit. Not really necessary. They could leave in their sleeper, but I see it's a trend. You know, a lot of people want that cute little outfit. I don't blame you, you know, for all your pictures.
Yes.
1 or 2 baby hats, car seats, and a car seat if you are driving home, or you know your partner is driving home, and if you plan to give the baby a bath, then the bath accessories, so soap, towel, and washcloth.
Yeah, super important. For your team effort, you're gonna want to bring phone chargers. You're gonna want to bring your cameras if you want to take pictures of everything that goes on, of your baby, the whole experience. Make sure that you have a hospital card ID ready and your insurance card, because they will ask you for this when you reach the birthing center. What you'll need between the time you get admitted till the time you're discharged is a big folder to keep all your documents.
Just like this. Could be something basic like this, but you know, something with pockets or an envelope or a basic folder. But the nurse is going to give you a lot of papers.
And you don't want to lose them, so it's really important to keep them all in a folder where nothing will get lost. And because when you get home, you'll have a whole lot more of distractions, so at least keep things neat and organized in one place. Super important to bring snacks. We do bring trays out to patients, but if you get hungry during the nighttime and you're breastfeeding, you're likely to be more hungry than normal. It's super important to keep up with eating frequently, so make sure you have snacks that you like. The other thing too is your delivery can be extremely long depending if it's your first baby or not. So, you know, we want to make sure that you're not super bored during your delivery process, so you can bring books, magazines, sudokus, just to keep yourself a little bit entertained, because the laboring process can take long before you're truly in an active labor, if you're being induced, that is.
And it's not always like the movies, guys. I know you see, the woman screaming in pain. Oh my God, I'm gonna die. If you're planning on getting an epidural, generally you shouldn't have pain, or your pain should be drastically diminished. So I know you're sitting there saying, I'm not gonna have time to read a book or take a nap or read a magazine. Yeah, like Carm is saying, your labor might be really long and you or dad might get a little bored. So, yes. I mean, 1 or 2 things, just in case. Okay, guys, so now it's your turn. We're curious to know, what do you guys supply in your hospital? What do the parents have to bring? What do you guys give?
Yeah, pretty much. And we want to know too, is there anything that we missed that parents might want to bring, share with other parents? This is a platform where we want everyone to be open and be able to share their thoughts and their comments. So yeah, we're leaving it open for you guys to basically.
And what was the one thing you had to have? Like, you were so grateful you brought it, or someone brought it for you.
Yes.
You'll be bringing it again for baby number 2, 3, 4, 5. What's that one essential that you need?
So make sure you don't forget to comment it down below.
Yes.
So that way we can see and everyone else can see it. But thank you all for watching this video. We really appreciate your support.
Thank you all for the comments.
Yes.
We've been getting so many DMs, like just so much positivity and really encouraging us. It's our first few videos, and I know they're not perfect, but we're trying, guys, and we're really proud of ourselves. So comment, thumbs up, and subscribe. Oh, could it be because I'm Bluetooth to it? And that's what's
I don't
stopping
think